Good afternoon, everybody. Welcome to my slot at the AGM. For those of you that don't know, I'm Vicky Ayres. I'm the clinical lead for the Adult Crisis Home Treatment Team, Single Point of Access, 24/7 service, and the Urgent and Emergency Care Mental Health Programme lead for Humber Coast and Vale. So I am going to be talking to you today about the COVID 24/7 mental health response all age telephone line. So I can't see my slides, but I believe you can. So if we could just move to the second slide, please. And if you'll excuse the fire alarm in the background. So working through the NHS England long-term plan, there will always be national directives. One of the key national directives was that there would always be a 24/7 access point for people to mental health services. Now, the implementation for this should always have been April 2021. In light of COVID, that was dragged forward very quickly to be implemented by April 20. So from Navigator, what we did was we got together with all of our teams and we said we need to make sure that we are hitting this response and that we are providing a service available to our entire population to make sure that they have exactly what they need in these uncertain and difficult times. So we managed to pull together a service within a week and get it up and running just as quickly with a number of different partnership organisations. So that service was due to go live at the close of play the 10th of April. Now we actually went live on the 6th. So we did really, really well. And that is testament to all of our partners and the way that we have worked together and so quickly and so willingly put into place the pathways that our population needed. Next slide, please. So the NHS England directive from Claire Murdoch, the Mental Health Director for NHS England and NHS Intelligence, was that established 24/7 open access telephone lines for urgent mental health support, advice and triage would be up and running for people of all ages. That we had to ensure that 24/7 open access crisis line numbers are available for the public, that they are clearly accessible on websites and alongside specific numbers for children and young people, should those be different lines. We had to ensure that all efforts were being made to divert people away from A&E departments where possible, and to make sure that this information was available on our trust websites and any literature that went out. We are unique, as discussed in the previous presentation, in that we do have a walk-in service. We are a standalone service in the UK for that, where people can turn up, they can self-refer, no questions asked, and you will be seen, triage and a mental assessment made. So we did tick a lot of these boxes already. We had an existing 24-hour single point of access and we had an alternative to A&E. We are a very forward-thinking trust. The final point is that where services were already established, we would look to address any additional capacity that may be required to make sure the urgent telephone access function was available and that we could provide follow-up for all ages. This is not something that we had in place prior to April. We, as a service for our single point of access, work with people from 18 years and upwards. So what we did was moved together with our partners from Young Minds Matter and made sure that we could offer a service 24 hours a day as a single front door for all ages, whether it be parents of children or children and young people themselves that wanted to contact us, and that we could make sure we were giving them the correct advice and urgent access to their clinicians and their practitioners for assessment and ongoing care if needed. Next slide, please. So as I've discussed a moment ago, the only way that this was going to work and the way that we've been able to pull it together so quickly was to work with our partners and to access a 4-tiered approach. And we'll go through the approach with you in a moment. But some of the partners that have worked very closely and continue to work in conjunction with us definitely deserve a name. So Young Minds Matter, Northern Lincolnshire Partnership Trust have very, very quickly adapted their services to make their clinicians available to us, both in hours as the duty workers and out of hours as the on-call workers, so that we can provide a service to our younger population. The Care Trust Plus LD and Autism Service adapted their services to make sure that we could contact where necessary and where we may have dual diagnosis clients and get those directly into service without delay. Our partners from Linksline, who we already work very, very closely with through our Rethink Crisis House and who provide our service in out-of-hours spa, immediately co-located to Harrison House so they could work in conjunction with our clinicians and they can make sure they had all the information, training and supervision available to them to take this increasing number of calls from our population. The North East Lincolnshire Council's wellbeing team very, very quickly got on board and provided a service for us, standalone to none other, that we could rapidly refer people straight into to have access, help and support for lower level emotional and wellbeing problems. We linked up with St Andrew's Hospice in the bereavement partnership and quickly established a pathway and a relationship where we could again immediately and without delay refer people who may be bereaved in any way, shape or form due to COVID or other. We changed our partnership working agreement with We Are With You, formerly Ad Action. We used to have a face-to-face dual clinic that we based here at Harrison House, and our clinicians from the crisis team would go and work in their premises. Of course, we had to pull that back very, very quickly in light of COVID and in order to reduce exposure. So what we managed to do there was get an agreement in place where we would continue that working, where we would be able to very quickly refer people into service, and that they would be seen, albeit virtually, on the majority of occasions as soon as possible. And we also started working much more heavily in conjunction with Longhurst and Havelock, our local housing provider, who provided a standalone service throughout the initial lockdown period of reaching out to vulnerable people and supporting the community in general, whether there were housing needs or not. So if we could move to the next slide, please, where I'll just explain the 4-tier service delivery. So the reason for this is based on many resilience models and all of the information and evidence available. We needed a psychological model that had a single front door and that was accessible by all people at all ages in all levels of need, distress and acuity. So tier 1 is very much managed by our single point of access, both in and outside of hours, and by our advice officers, who I absolutely have to put my hands up and say they have been amazing throughout this entire process. They were the first team to go remote. They went remote immediately with absolutely no interruption to service delivery, and I could not be prouder of that team and the way that they have managed to conduct themselves and work in these really difficult times at home alone, dealing with some of our most acute clients. Well done to them. Our team through Rethink had co-located to Harrison House. What that meant was that they had clinicians on hand should they be struggling to deal with anybody, should they be needing any more support or an instant referral into our high level services. So tier 1 is very much for the general population, where we would speak to everybody that wanted help and advice. And this level is very much about non-mental health, non-clinical issues, very much pre-IAPT level. Things like worry that's affecting sleep, worry about returning to work, worry about employment, about furlough, stress from childcare issues, physical health issues. We had a lot of contact through our general population with general worry issues that weren't clinical but needed support, and that's the level that we provided it at. Our tier 2 service is very much mild to moderate, and that is where our colleagues from the North East Lincolnshire Council wellbeing team came into play, offering virtual one-to-one support for up to 6 weeks with people and providing them with help that was not so much self-help but more guided self-help. Also supporting them to address practical issues, whether it be housing, employment advice, relationship issues, being able to contact loved ones that they hadn't been able to see for some time due to the circumstances. That relationship has now gone from strength to strength, and we've spent a lot of time liaising with the council and shoring up our pathways to make sure that that area in service, that gap we may have had before, that we may not have really understood the services that were in place and how to refer into it, has now been filled, and we will continue to work with them as we move forwards. Tier 3 for our service was for those moderate needs. So any needs where there was increased risk, increased illness, increased mental health issues, and anybody with a level of distress that was so high that they would need that face-to-face appointment to be able to determine any further needs or ongoing care. What's important to remember is that throughout all of this, you can move up and down the tiers. It is a very fluid model. So even if you come in at the point where you are at crisis, where you absolutely need to be seen face-to-face by one of our clinicians, if following that assessment and a period of care and a follow-up, you no longer needed any support from that team, you could move back down the tiers and continue to access support. You wouldn't need to be re-referred in or anything like that. What we wanted to do was make it very simple at the point of use for our people in the community. Tier 4 is very much reserved for those severe cases that require instant access to psychology. And what we very quickly did, and I'm very thankful to our community psychology team, is made sure that we had people on hand every working day to provide appointments if needed for those that may need very intense therapeutic services, no matter what the need may be in light of the response to COVID. Now, thankfully, I'm glad to say we've not had to use that service very often. In fact, I'm not sure we've actually had any cases that have required that immediate support, but it's been there, and we have certainly worked very closely with our colleagues from the psychology services to make sure that we've covered all bases, and that any individuals who may be within their services already who have required other elements of support, they've been able to access that through the tiered structure. So it's very much a fast track model. The entire point of this model is to make sure that people get what they need in a timely fashion, and that's preventative. We look to intervene at those lower levels so that we don't have to work in a crisis situation, that people's lives are as uninterrupted as possible, that they get the right service at the right time to prevent them from coming into hospital, potentially harming themselves due to their level of illness, distress, or self-harming behaviour. We can move on to the next slide, please. So we've very much talked about our population in North East Lincolnshire, and we did not lose sight of the fact that we needed to look after ourselves too, that we needed to make sure that there was staff support available, that throughout all of this, we have kept coming to work. We have continued to support our local population, even though every single one of us has been affected in some way by the global pandemic. We all have our own worries, anxieties, family members that are vulnerable. We may have been vulnerable ourselves. So we wanted to make sure that in order to keep our services running, to keep staff on the ground, and to make sure that we remain healthy and able to provide these services, that we had a very rapid access service for our colleagues, both within Navigator and within all of the partnership organisations who've worked with us. So with that in mind, there are a couple of different options that we made sure all linked together. The first being our line management and occupational health structure, which of course anybody can access at any time, be it via your line manager or a self-referral. You can contact via the email address, the staff support email address, which is available on everybody's desktop across the organisation. And for those who aren't within the organisation and maybe our partners, have been communicated in various different formats across various different media platforms. And we also had floor walkers. We had those outreach workers who were on the ground. Our community psychology team based themselves within team environments at different times in different places throughout the week. We had members of staff from the CMHT go into our general hospital environments, both at Diana Princess of Wales Hospital and at Scunthorpe General Hospital, to provide that very much needed psychological first aid and that support for the staff on the ground dealing with the pandemic in our acute hospitals. We've had quite a bit of uptake for those services, and it's really heartening to see that people are happy and willing to engage with their own services, and that we are fulfilling our Navigator strapline of providing services that we would be happy ourselves are for our family to use, and that's been fantastic. And next slide, please. So the next slide again is just detailing the Navigator staff support, how we might use it, how you can access it, really to fortify the point that we all might need something at some time. We all have a level of resilience and we all have a level of tolerance. I, for one, know that everybody within the organisation, including myself, have had periods where I've thought, maybe I need to speak to somebody about this. Maybe I need a little bit of support, a bit of supervision. Doesn't need to be formal, might just be a chat, might just be a vent, might need to just talk about what's worrying me, get it off my chest and move on with my day. That option's always available, and we want to make sure that everybody's reminded of that as often as possible. The next slide, please. So this has been challenging. It's been a challenging project initially in terms of the very tight turnaround. We set this service up at pace with our partnership organisations. Everybody was fantastic. Everybody was more than willing to say, what more can we do? How can we do it? What do you need from us? And some of the positives in that have been that we have managed to span the entire population from primary care, secondary care, specialist services, voluntary organisations, and we have built some really strong relationships and fortified some existing relationships. A challenge in that is that service provision across a number of different services, across a number of different electronic record systems, platforms of communication and means of referral, is very, very difficult to navigate. So whilst it might be as simple as possible at the front end of the service that all you do is ring that telephone number 256 option number 3, the administrative processes in the background of that have been quite tricky, and is something that we continue to work on, because quite frankly, we're not bothered how hard it is for us in terms of what we have to do on the computer. We want people to be able to access the service and get what they need. So we continue to work on that. The increased understanding throughout our partnership organisations, throughout our voluntary and community sector service, sector support, the community hub, all of the different services that we've linked in has been phenomenal. We've been able to get a much deeper understanding of what's available in our local community, who can access it, how we can access other resources outside of our local community, our online resources, how we will provide self-help to people, and where we can signpost people in all eventualities, whether there is an underlying mental health need or not, so that people can get on with their lives and have that purposeful activity that is keeping people going in these still uncertain times. Another challenge we did face was the very, very rapid need for some live staff training. We've managed to do that. We've managed to continue to do the supervision. I liaise often with all of the different service managers to make sure that we keep that into place, that we keep a clear understanding where there might be issues within services with regard to workforce and whatever's happening in the teams in light of the pandemic and the effect thereon. We're making sure that we have all bases covered. All in all, I think it has been absolutely fantastic in terms of the partnership working and how quickly we've managed to pull this together. There have been teething bumps, there have been implementation problems, but there's always been the forum to ask the questions and see what's going on, how we're going to do that. Final slide, please. So in terms of what are we doing with the service now, how is the service running, how are we evaluating it? We have been able to collect lots of different data across the organisation, across the different partnership organisations, and what that has done is allowed us to gather the intelligence to see where the resources really need to be, what age groups need certain things, which direction should we point our services in to make sure that our community at this time gets what it needs, because on the whole, our usual patterns, our usual dilemmas of access to service have been very different this year. Barriers to that have been, of course, funding, although we have been very, very grateful to work closely with our clinical commissioning group and to be able to continue this project and to continue to have that buy-in from our local services as they move back to their normal roles. And that is something that we will continue to work with moving forwards. My conclusion today is that the success to this project and the continuation of this project has been a testament to the partnership working and all of those people engaged. I am extremely grateful to be able to have pulled all of these people together and for them to continue to work and continue to support all of the hard work. The next steps, what will we do now? We are looking to fortify our pathways, looking to make it even easier if possible, not just for that person at the front of the service who would like to access the services via the telephone number, but also for those working within the services to make sure that the administrative element of the service is as simple as possible so we can keep it moving and prevent any small little hiccups that come from our admin processes. We are looking to establish even greater links with our community to make sure that we're working as closely as possible with our community service hubs, to work more closely with our primary care networks, and to feed into the wider resources, whether those be online resources that span the entirety of the UK, or whether they be our ground floor resources within this area. And we will continue to do that. So if anybody knows anybody that they think we should be working with, or resources that they're aware of that they don't think we're linked up to, please do get in touch with me. Let me know, and that's something that we will move forward with. So I am now being told that there are no questions, so I will draw this to a close. I think everybody's got my contact details. If not, feel free to email me. I'm sure the information will be available from the AGM's information. And thank you very much.